So this is really a transformative time, and we're seeing the real power and potency of immune therapy for myeloma in the clinical setting. So clearly a major focus of attention has been on CAR T cells targeting BCMA. There's been, I would say, a sort of growing understanding of what both the strengths and weaknesses of the treatment are. We're seeing in the initial reports very high levels of response in patients with advanced disease. And that's been, I would say, really provocative because these are patients that have very limited sort of chances of long-term response to any therapy. And I think that has been sort of then complemented by a sense of how long do those responses last. So I would say the most mature data that was reviewed here as well had to do with a study showing about a 12-month progression-free survival on average. There's some question as to whether there is a subset of patients that remain in remission, but it's clear that most patients do eventually relapse. That's led to really, I would say, some important investigation about what are the mechanisms of resistance and what causes relapse to ultimately occur. It appears that this is a multifactorial process that involves everything from the persistence of the T cells themselves, their functional status, and whether the antigen target, in this case BCMA, can be modulated to avoid recognition. So the sort of next wave of investigation, I think, is really about tackling those issues for CAR T cells. And there's been some exciting areas of development there. The other areas that people are looking at include the bispecific antibodies, or the BiTEs, where there's less clinical information, but some provocative early data suggesting, again, high rates of response. Durability still remains a challenge for us, and there is some toxicity that we have to deal with. We've also heard about the antibody conjugates, again, with some excitement about early response, some issues with toxicity that are being dealt with, and vaccine therapy and sort of idea of how generating an in vivo response can complement some of these other approaches and how we would use these different treatments. So a lot of focus on both how to make the therapies better and also what's the right setting to explore them in.